I think that it will require very specific dialogue and communication with regulatory bodies, because it's something that we don't know. It's very different from a regular clinical trial or clinical translation of a regular drug, because we're talking here about live bacteria. So that means that that's all new. Regulatory offices are not really aware of what is needed and what is essential and what is not. So that is one. So that will require, and there are steps being made. Another one is that since we are using live bacteria, in terms of making the first step, and that is, for instance, determining the dose, how it would be in a normal classical clinical trial, we cannot do that, because the dose that we give might be very different compared to the dose that will eventually end up in the tumor. So that is also, this entire mindset needs to change. So it requires lots of communication with regulatory bodies. Apart from that is all the procedures needed for good GMP, so for good clinical practice. That needs to be very well streamlined to make sure that bacteria are free of other pathogens or of pathogens or other contaminants, which is something that is procedure-wise very different compared to regular GMP production of drugs. And eventually, I think what it will boil down to is, once we have these procedures, once we have talked to regulatory bodies in terms of things that we need to do that are very specific for these live bacteria, it will boil down to making good, let's say, teams together with researchers, with infectious biologists, with clinicians, with medical oncologists, with radiotherapists, with people that do imaging and so on, because we will need all of them with very specific expertise together to make this work. But once we do this, really, the potential is endless.